Hey everyone, for our Module 2 discussion, I wanted to start with a quote from Chapter 3 where it says that there's a common assumption that the people who live in rural communities tend to be alike and are generally not a diverse group. I think our reading clarified that rural communities are indeed very diverse. The area of diversity that I would like to discuss is that of socioeconomic status. There are people in rural communities who have plenty of money and plenty of resources at their fingertips. And however, though there are many people in rural communities who do not have many resources and do not have money easily available to them. And many of these people um, who lack the resources and lack the money often also lack education or suffer from health conditions, food insecurity, all sorts of other things that go along with this lower socioeconomic status that makes it very difficult for these people to often to get the resources that they need and the resources that are available for them. Sometimes they just don't know how to get access to them. Um, the social services system is often very difficult to navigate. It's my job. I'm a community health worker in Tennessee, and navigating that system is really what I do. I work with adults 18 and over who are uninsured and have many health related social needs. Um, so I deal with a lot of these type of situations. And the policy issue that I want to talk about today, and it's one that I also deal with very often with the patients that I see, is insurance and the lack of coverage for many people uh, that I see and work with. Not just in Tennessee, but that's a problem across the country. Um, and Tennessee is where I live. And so I want to look at TennCare, which is our part of our Medicaid system. And for an example, I want to talk about a young adult male who has some pretty severe mental health issues and diagnosis. This person has applied for TennCare, let's say, and has been denied. So that's not great. And they're unable to maintain steady employment due to their mental health conditions. Um, and so they can't get insurance on their own. So, for those of you who are not familiar with Teen Care, who don't live in Tennessee, they have a pretty narrow and specific guideline for who can be covered. And I'm going to read you this information. I have it right here about who can be covered. Teen Care says you must be in a group we cover and be under the income limit for the group, which lots of people will fall into the income part. But here's a little bit more of it. Some of those groups include children, pregnant women, caretaker, relatives of minor children, people who are getting Social Security, and who used to get SSI checks, people who need treatment for breast or cervical cancer, people who need long term services or support, or people who've been in the hospital for at least 30 days and meet the rules for the aged, the blind, disabled, a child, or pregnant. So this excludes lots of people, and even people maybe with cancer, terminal illness. Sometimes, if they don't have specific types of cancer, it can be pretty difficult for them to get covered. So this leaves the example of my young adult male uninsured and still unable to maintain his steady employment so that he can get insurance. This is problematic on several different levels for him. He needs insurance so that he can continue to get medical care and that he can continue to get mental health care and that he can continue on the medications that he is taking that will help his mental health uh, diagnosis and situations to improve and continue to improve and be manageable. But he can't do that if he can't pay for his medicines, and he can't pay for his medicines if he does not have a job. And you can kind of see how that circle goes round and round and round and is super frustrating. So everybody can look at how this policy of insurance coverage for the state of Tennessee can actually make it very difficult for some of our people that we serve in rural communities. So, thank you very much. Have a good night.